Hello everyone, myself Dr. Taposh Kumar Pal and welcome to my channel Physiomax Organization. Today I'll be showing you one of the MRI of my patients, and actually the problem what he was having, and the time we have assessed, he was having difficulty in walking, he was having difficulty in holding any objects. So the time we assessed, he was having a severe pain in the back and the neck, and with the history we came to know it was for a long standing pain, like he was having this problem in the last 15 years and he was in some painkiller medication. The time we did the MRI and we show few of the findings, and for showing this only I am showing you this MRI plate. And if you see the MRI plate properly over here, we can see few of the most important findings, and this is the views of the MRI you are seeing over here. And here you can see this is the spine, this you can see this is the C2 spine, C3, C4, C5, and if you see in this particular region, this all are the vertebra, this all are the vertebrae of this particular spine, vertebral bodies. And you can see the black is one over here, this is what's the spinal cord used to go from here, and you can see the white spot, this is the cerebrospinal fluid. By the time we are seeing this MRI over here, we can see how in the C2, see the normal sac, the whole sac length, and the time we are seeing over here, see suddenly how the sac is compressed from both anterior and the posterior aspect. And this is what is the thecal sac compression, what we used to tell. So you can see the findings. If this is the C2 and if this is the C3, here is the thecal sac compression. Again we'll go down. If this is a C3, C4, C5, C6, C7, again we can see a mild thecal sac compression over here. So maximum of thecal sac compression, this is in the C2 because of the disc herniation. You can see how the disc herniation it is, so it's showing it's compressing the thecal sac. If we'll go down, we will go directly straight, and if you see in the lumbar region, and if you see we'll go, see it's written over here, this is the L5 vertebra, and in the L5 vertebra, so this is the L4 vertebra, and this is the S1. Again if you see the L3 L4, in between the L3 L4, how that thecal sac is getting compressed over it. See the normal size of the whole spinal cord and the CSF fluid you can see, but you can see over here how it is getting compressed in this particular region. So he is having the L4 L5 disc compression, and it's a chronic disc compression, disc herniation result in the spinal cord compression over here. If you see little bit further, this is the L4, this is the L5, but in this L4 vertebral body we can see the vertebral body it became quite eroded. We can see the osteophytes formation in this region, and we can see the degenerative spine. So yes, he is having a severe degeneration of this particular region. So these all the things what we can find from this particular MRI. So he is having the C2 C3 disc herniation over here, again C5 C6 disc herniation, and L3 L4 disc herniation which was in a chronic. Now I am showing you another plate of the MRI where we can see the thoracic cavity, thoracic spine. These all are the thoracic spine over here, and you can see how the thoracic curvature is increased for this particular person. So we can see the increased thoracic kyphotic posture for this patient, and increased level in the thoracic spine. Again the thoracic vertebrae, it does not have that much of disc herniation or any type of degeneration much for the thoracic spine, only except that he is having a severe postural deformity for the thoracic spine. হাঁটুন আপনি। So I have showed you the posture of this particular person who is having the severe disc herniation on this particular toe region, and as it was in a chronic condition, he has neglected this particular condition for a long days. He was under medication which does not have any particular effect for this particular condition, and the result in the time we are seeing, and you saw how the person is walking. He has is it's the whole body, it's got bended anteriorly, and that's the effect of not having a proper treatment. And again, he does not have that much of power for this particular heart, and that's the compression myelopathy. Because of the nerve compression for a long years, the muscles it's become very much weak, and he is having severe difficulty of holding any of the objects. So this type of patients, this type of persons, those who used to neglect for this type of conditions, it's quite difficult in the late stage to manage. Yes, physiotherapy in some extent it can help to recover, but yet if it is too late, it's quite difficult to treat, because once it's the compression where there is a, in the time we did the NCV, the values for this particular MNCV for the median nerve, it's quite less. Again, for the sciatic nerve, the MNCV values, it was quite less. So that's the reason why he is having a severe neurological, and that result in both the sensory and the motor dysfunctions. So this is, it's a case what I showed you people. Hope people understood the importance of early diagnosis, and of course in sometimes whenever you are having any difficulty of understanding, you have to go with the further diagnostic test like MRI, you have to go with the NCV to understand the level of the injury, to understand the level of the compression, and of course to understand the level of the dysfunctions of the particular nerve and the muscle. Yes, we did not go with the EMG. He is taking treatment with us and for the last few months, and hopefully we can recover, we can gain a few particular muscle power to our some extent. Thanks for watching this video. Those who are new for this channel to learn this type of medical informations, don't forget to subscribe the channel, and don't forget to like this video. Thank you once again. We will come with some new videos. Thanks. Till then.